Hi there, welcome to your Bone and Joint channel. This is Dr. Shayesteh Orthopedic surgeon. Today I'm going to discuss about frozen shoulder. What is the definition of a frozen shoulder? Frozen shoulder, also called adhesive capsulitis. It involves stiffness and pain in the shoulder joint. Signs and symptoms typically begin slowly, then get worse. As you can see, this is the anatomy of a shoulder joint. That's clavicular bone, acromion, coracoid process, that's part of the scapular bone, and then humerus. This is the ligament mostly involved in frozen shoulder. That's part of the subscapularis muscle, and it gives support for the anterior part of the shoulder joint. So when this ligament gets inflamed and thickened, that's what we call frozen shoulder. In this picture, you can see front side of the shoulder or anterior and posterior side of the shoulder. On anterior or front side of the shoulder, we have subscapularis muscle, which all the tendon part of the subscapularis muscle comes to the front of the shoulder and gives stability to the shoulder. And then in the back side of the shoulder, we have supraspinatus muscle, infraspinatus muscle, and trapeze minor. All these three muscles come together and create a ligament or tendon part which connects to the posterior part of the shoulder and gives very strong stability for the shoulder joint. All these four muscles together shape the rotator cuff muscles, rotator cuff tendon and the muscles. Any of these tendons can be inflamed and thickened and be painful in adhesive capsulitis or frozen shoulder. This is another picture, shows healthy rotator cuff muscle, and this is frozen shoulder situation, thickened and inflamed. Again, another clear picture, healthy capsule, thickened and inflamed capsule in adhesive capsulitis. What are the symptoms? Frozen shoulder typically develops slowly in 3 stages. Freezing stage. Any movement of the shoulder causes pain. Shoulder's ability to move becomes very limited, and this stage might last 2 to 9 months. And then we have frozen stage. Pain might lessen during this stage. However, the shoulder becomes stiffer. Using it becomes more difficult. And in this stage, might last for 4 to 12 months. Towing stage. The shoulder's ability to move begins to improve. This stage lasts from 5 to 24 months. For some people, pain might get worse during the night and disrupts their sleeping. What are the causes for the frozen shoulder? In some people it might be unclear, but most of the time it happens after keeping the shoulder still for a long period, such as after surgery or an arm fracture. What is the risk factors? Age and sex. Over 40 and women, they have more chance of a frozen shoulder. Immobility or reduced mobility, which means if there is any rotator cuff injuries, broken arm, stroke, recovery from surgery, any reason which shoulder gets immobilized for some time can be the reason for the frozen. There are some other risk factors for the frozen shoulder. Some systemic diseases like diabetes, hyperthyroidism, hypothyroidism, cardiovascular disease, and Parkinson's disease. How you can prevent the frozen shoulder? One of the most common causes of frozen shoulder is not moving a shoulder while recovering from a shoulder injury or broken arm or stroke. If you had an injury that makes it difficult to move your shoulder, talk to your doctor about exercises that can help you maintain your ability to move your shoulder joint as soon as possible. How the doctor can diagnose your disease? Like always, history, physical examination, a thorough examination by your doctor. Doctor might need to find out how limited is your active range of motion or passive range of motion, which both they can get affected during the frozen shoulder. Frozen shoulder can usually be diagnosed from signs and symptoms, but imaging tests such as X-ray, ultrasound, and MRI can be very helpful. What's the treatment for the frozen shoulder? Most of the frozen shoulder gets better by the time, but on their own within 12 to 18 months. But during this time, you need to have some medication, physiotherapy to control the pain, maintain or preserve as much as the range of motion it is possible. If the oral medication doesn't work, your doctor might decide to go for steroid injection in the shoulder joint or hydrodilatation using still water to dilate your capsule, and it can combine with the steroid injection. And then sometimes we use shoulder manipulation of the shoulder joint under anesthesia, which improves your movement, and sometimes surgery, arthroscopic surgery, as a tool to remove the thickened capsule and increase the to help to improve the joint movement. What you can do at home or change in your lifestyle to help you to overcome to the frozen shoulder as soon as possible. Continue to use your shoulder and arm as much as possible, given your pain and range of motion limits. Applying heat or cold to your shoulder can help relieve the pain. In this picture, you can see some simple and effective exercise to fix a frozen shoulder. Pendulum stretch. Pendulum stretch. You can use a chair and do this exercise. Hang your affected arm and try to do these pendulum stretches. And then crossbody arm stretch. Then towel stretch. You can use a towel behind your back and try to repeat these movements. Then shoulder flexion. That's a shoulder flexion exercise. Arm circles. This one. And then here armpit stretch. These are very effective exercises to overcome to the frozen shoulder and fix it. Very simple and very effective exercise which patient can do without any problem, simply at home. What can you do before seeing your doctor? A complete description of your symptoms and when they began. Information about medical problems you had. Information about the medical problem that your parents or siblings they had. Names of all medications and dietary supplements that you take. Questions to ask the healthcare provider, your doctor. Be prepared to answer some of these questions. What makes your problem more, or what worsens your symptoms? Have you ever injured your shoulder? If so, how? Do you have any systemic disorders like diabetes or cardiovascular disease or Parkinson or any other diseases? And have you had recent surgeries or had to keep your shoulder still for some time, these are the questions your doctor might ask you. With this slide, I'm gonna end the frozen shoulder section here. Please subscribe to the channel and leave your questions and suggestions in comment below. And please join me in the next video. Thank you very much.